Today I'll be talking about how parental interactions affect premature babies' development. The reason I chose this topic is because research is important. It helps us to better understand premature infants so that we can then learn to care for them. It is best for those in the medical field and parents to view and listen to what I have to say. How does proper care for parents in the first few months of a premature infant's development affect them? This is a huge ongoing debate in the medical care and parental fields. The question is, can parents support and care for the child help improve the infant's rate of growth, weight gain, and overall development of the infant? After viewing Msall's article, Optimizing Parental Involvement and Care for Premature Infants, and White-Traut and al.'s article, Influence of the H-HOPE Intervention for Premature Infants on Growth, Feeding Process, and the Length of Stage during Initial Hospitalization, it has shown me the effects that the H-HOPE program can have on a premature infant, provide people with better information on the most effective way to care for a premature infant, by both medical professionals and their parents. Many different factors can affect an infant's development. The primary factor that plays an essential role in the development of a child is their parents' care and their touch. My presentation is on the specific role parents play in a premature infant's life that then helps them improve over the course of the first few months, while still visiting them at the NICU and caring for them. Msall's paper is about how the H-HOPE program is used and goes into the details about the study, and uses White-Traut and al.'s report to back up his findings and beliefs. In White-Traut and al.'s article, they write about the details of their experiment, the research they then composed, the objective of their study, the study's design, and the final results of the experiment, and the conclusion that the program has brought to us about premature infants. In Msall's article, it explained that the H-HOPE program was designed to help parents and people in the medical field better care for premature infants. His paper is based more so on other people's studies and findings to back up his own thoughts and ideas on how to improve infant care. Msall's paper was written to find new ideas and techniques to better excel in prenatal care. His paper focused on the structures of the infant's feeding, positioning, healthy behaviors, and social interactions with the parents. With this information, we can develop new techniques to improve infant care for the better. The main points found in Msall's paper are that the initial hospitalization can provide essential details on how the child will develop once they are released from the hospital. They can discover the strength of the child, record their development, and the weight gain over the time spent at the NICU. While processing the infant's overall development, we can determine the factors that help decrease the total time it takes for an infant to become healthy enough to go home. In White-Traut and al.'s article, they describe how the H-HOPE program intervention works with premature infants. The report shows the specific evidence on how parents affect the child's growth and weight gain. The article is based on their scientific research, which was conducted on multiple parents with premature infants. It tests the process of how quickly a child will develop with more or less parental care. The overall results were more favorable for parents that cared and visited for their baby more than the parents who did not, resulting in an early release from the NICU. They supported their findings with rigorous analysis and the overall outcome of the infants of the H-HOPE program. This experiment was done with the intent to gain a better insight on how to care for premature infants, as to decrease the time they spend in the NICU, and to increase the numbers of infants that survive after the first few months of being born. These articles show us the importance of being involved in the care of our child during the first few months. By nurturing, holding, and caring for them, we can expect a better outcome and bring them home safely. These articles combine to show the best ways for parents to breastfeed, care for, and support their child most effectively. With this, we can gain better insight in how to care for the future